Gone are the days of a veterinarian simply dictating what needs to be done and a pet parent blindly following instructions. And this is a good thing. Instead, our pet's healthcare plan, whether we're optimizing for wellness or treating a health challenge, is based on the veterinary team and the pet parent working together to decide the best course of action for their dog. And informed consent, which is the process of talking and asking questions until you've got enough information to make a decision about your healthcare, is the cornerstone of this in the human medical field. And it's also the approach that we take in our pet dogs and cats. So, what if I told you that true informed consent is impossible? Hi, I'm veterinarian Dr. Alex. This is Our Pet's Health, where my aim is to help you and your dog live the full, happy and comfortable life that you want for them. And there's a popular meme that says, don't confuse your Google search with my medical degree or veterinary degree, and there are many other ones out there as well. And while this is more than a little condescending and patronizing in a lot of situations, it is actually very challenging to communicate complex ideas where really the whole picture can only be appreciated by going through vet school, by spending 5 years studying pet health and the dog body. And that's not to mention the kind of continued learning that happens throughout a career, because no matter how well your vet communicates, and certainly some vets are better at communicating than others, it can simply be impossible to discuss every single eventuality, every complication, every consequence of all of the different potential decisions that are open to you, let alone to do so in a way that is understood in its entirety with absolute clarity. And this is especially the case when we're dealing with more complex medical decisions where there are several different paths that can be taken, and really we're making a best guess based on imperfect knowledge. It might be that there are limitations to the number of tests that can be run, to whether any tests can be run at all, to whether there are the skills and the resources to carry out those tests, to perform that surgery, as the equipment available. Equally, history might not be 100% accurate, and I say time and again that history, so that is the vet asking you questions. If you come into my consult room, I'm going to almost kind of bombard you with lots of questions so that I can get a really clear understanding of exactly what's going on in your dog. Are they vomiting? What are their stools like? Are they really drinking normally? What are their energy levels like? Is there any problem with their exercise? Do they seem uncomfortable? Depending on the problem, really there's going to be a lot of questions, and it can be very difficult to answer those with a high degree of certainty. And I can say this as a pet parent myself. If someone asked me about my cat's toileting habits, I would really struggle to answer that with any certainty, because they go outside and they don't tend to go inside. So I really just don't know. So, it's true for me as much as it is for you. And this is a limitation that we have when we're dealing with an animal who can't communicate for themselves. You don't know what they're doing overnight, and they can't let you know that information. Now, there are kind of Fitbits for pets, if you like. There are wearable trackers that can give us a little bit of an idea, and they are really an exciting development. But many times we are dealing with a number of limitations. And then add into this the fact that advice and discussions are always going to be biased towards personal experiences, and that's personal experiences of you, but also your veterinarian. Our intrinsic beliefs, our treatment philosophies, they are very important when it comes to deciding and explaining and discussing what the problem is and where we need to go from here. I've been in practice for 16 years now, and my judgment and my thought processes are definitely influenced by cases that I've had in the past, those that have gone really well and those that maybe haven't gone to plan. Equally, if someone is really keen on surgery, then they are maybe more likely going to be pushing for a surgical solution. A medic, someone who really gets their kick from diagnosing the kind of the more weird and wonderful, the more challenging conditions, are going to be quicker to run tests for these these uncommon conditions. And that's just two examples. So no matter how impartial I think I am, no matter how impartial and well-rounded and balanced your vet thinks they are, and you think that you are, I know that we all see the world through a different lens, and that's going to impact some of the discussions that we have. And with this in mind, a trusting vet-owner relationship is vital for both parties. And that's, I'm not saying let's go back to the old days where you just trust your vet and follow their advice blindly without asking any questions. But if you don't trust your vet, then you really are better off finding one that you do trust and that you can work with throughout the life of your pet. And then when you do go and see your vet, to get the most out of each vet visit, you really need to check out this video linked on screen now so that you can get the best value for money, but also so that you can help your vet help your dog. So tap on that video, and until the next time, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.